We really believe that the traditional medical school education is necessary to become a physician, but not quite sufficient. So we focus on the social determinants of health, including race, socioeconomic status, income, ethnicity, and our curriculum is woven through all 4 years and even into our residency programs.
It's a part of our mission to really engage that issue directly. And that includes dealing with racism, so making sure we have an anti-racism curriculum, making sure that our residents understand their role as physician leaders in communities to work with and partner with community organizations in order to make our communities healthier. I've also in recent years been working with the medical school curriculum in order to make our community medicine track more robust and really make sure that our medical students are really getting that training of understanding how health disparities occur and how they impact their future patients.
A lot of what the work Dr. Pasha does in implicit bias, he brings a different perspective to the table, which I really appreciated and kind of learned a lot from during my training. And just the population of patients we see both at the hospital and in our clinic. I've had to use a lot of skills trying to reach out to different patients, and I hope to carry those skills going into the future.
I think that one of the things that I love is I've always felt very welcomed here at OU Tulsa, and I've been able to connect a lot with my patients. We have a very diverse faculty in our Department of Pediatrics, and we also have a diverse patient population, and I think that diversity has allowed us to, again, connect better with our patients and allow them to, or help them navigate in the medical system.
I'm super grateful to be a part of the Diversity Task Force here at the OUTU School of Community Medicine. It was started by Dr. Meredith Davison and has received such great support from Dean Herman and other faculty and staff and students at our school, and we're just really focused on looking at our numbers, making sure they are increasing to match our population, and also to make sure that we're teaching our students important things and important background on race and diversity in healthcare and how it does contribute to the lives and the quality and well-being of our patients. So I'm just super excited that we have such great leadership here that is really taking on this tough issue that is very just so in the forefront of our nation today.
I work on different communities where we're trying to improve our diversity and inclusion here on this campus. And with that, we've been able to provide certain curriculum changes that will allow us to improve our connection with people in communities of color, but also improve the way that we do things here at this institution and improve the amount of people that we have seen in demographics that are covered in our student demographic.
This group is actively working on the development of a structural racism report card for our campus so that we can measure our progress towards becoming a more inclusive environment.
So we have decided to create a faculty book club, and we call it a book club, but it's really more than a book club. We're naming it Inclusive Conversations. And in this book club, we're gonna look at not just books, but all various forms of media, podcasts, journal articles, movies, and just provide a space where our faculty can talk about issues regarding race. We feel that if we can get our faculty more comfortable to talk about these discussions, obviously they're going to be had more readily. And I think we are setting an example for the rest of our campus by showing that the leaders on campus, our teachers on campus, are taking the steps in facing some of these difficult conversations, and ultimately that's going to help us all around campus. We hope that it helps the way we teach our students. We hope that it helps the way we take care of our patients, and I hope that it sets an example for the rest of the Tulsa community on what can happen when we all kind of take that big leap forward to talk about race and the issues revolving around race.
The Graduate Medical Education Office is actually providing a Minority House Staff Association, which is specifically for residents from diverse backgrounds to connect with one another and also work with faculty from different residency programs in order to kind of have an inclusive environment to have discussions on what's going on campus or ways that we can encourage learning opportunities and diversity in our community.
Big reasons that I chose to come to the School of Community Medicine is because of its mission and commitment to improving the community by not just looking at patients as numbers, but patients as people and how to improve the community one person at a time.